Chronic inflammation, basically it is characterized by the macrophages, lymphocyte and plasma cell, which lead to the simultaneous tissue destruction and repair. So basically in the chronic inflammation, when there is infiltration of macrophages and the lymphocyte, these inflammatory cell will come to the injured area and destroy the tissue and help in repair. And how they will help in repair, basically you guys have to remember, during the inflammation we also have different kind of anti-inflammatory molecules that are going to produce. So after that you guys have to remember, as I already mentioned, it is always preceded or followed by acute inflammation. Like first you will get the acute inflammation, after the acute inflammation you will get the chronic inflammation. So then again, what are the stimuli for chronic inflammation? So if you have the TB, Treponema pallidum infection, fungal and viruses, so these are the inflammations, these are the, you can say, the infections which can lead to chronic inflammation. Then if your body has the persistent infection of these bacteria, it can lead to, you can say, type 4 hypersensitivity, because we see that the type 4 hypersensitivity have the CD4 cells, your lymphocyte. So that's why they mention here chronic inflammation can occur in type 4 hypersensitivity reaction. Then also if you have the autoimmune disease, if you have prolonged exposure to toxic agent like silica and foreign material, they can also induce the chronic inflammation. So these are the important chronic inflammation stimulants. Then after that we have to talk about the mediators. What are the mediators that are going to produce the chronic inflammation? So macrophages are the dominant cell, you guys have to remember. Then these macrophages basically are going to interact, there is an interaction of macrophages with T cell. When the macrophages are going to interact with T cell, they will help in production of chronic inflammation. So here they mention the important mediators like T helper 1 cell secrete gamma interferon, which is going to activate the macrophages. So these are the pro-inflammatory cell. When the macrophages are activated, they will produce the interleukin 4 and interleukin. You guys have to remember, when the macrophages are going to activate it, these macrophages are going to activate the inflammatory pathway. Then after that we have the T helper 2 cell. These T helper 2 cell will produce the interleukin 4 and interleukin 13, and these will go and you can say activate the macrophages that are going to help in repair and anti-inflammatory pathway. So they can ask from you in exam, like in the chronic inflammation, T helper 1 cells are going to secrete which things? They will secrete the gamma interferon and it will activate, you can say, the macrophages. Then after that T helper 2 cells secrete the interleukin 4 and interleukin 13, and they will go and help in repair and anti-inflammatory molecules. They are also called the anti-inflammatory because they are going to repair or finish the infection. Then after that again we have to understand the outcomes of chronic inflammation. So scarring, amyloidosis, neoplastic transformation. Like if you have chronic hepatitis C infection, you will get chronic inflammation. This chronic inflammation will damage the hepatocyte, that will lead to hepatocellular carcinoma. So if you have the H. pylori infection, that will lead to chronic gastritis, and chronic gastritis can cause the gastric adenocarcinoma. So here they mention basically the you can say the important outcomes that can occur in inflammation. And I already explained in the amyloidosis. Basically in the case of amyloidosis, you will get the different kind of proteins that are going to produce during the inflammation, and those proteins are later going on to be accumulated in our body. When those proteins are going to be accumulated, that will lead to the damage of different kind of organ. Then after that we have to understand the important mediators that are going to help in wound healing, and they can ask from you in exam, what are the important mediators that are going to stimulate the angiogenesis. Angiogenesis means the formation of blood vessel. So if there is a production of fibroblast growth factor, it will go and stimulate angiogenesis. If there is tumor growth factor beta, it will go and stimulate angiogenesis and fibrosis. If there is the vascular endothelial growth factor, it will go and stimulate the angiogenesis. Then also if there is a production of platelet derived growth factor, that will go and that will help and stimulate the fibroblast growth factor for collagen synthesis. So they can ask from you in exam, how the platelet derived growth factor is going to be secreted. It is secreted by the platelets and macrophages. It will go and induce the vascular remodeling and smooth muscle migration. It will go and stimulate the fibroblast growth factor for collagen synthesis. So if they ask from you in exam, during the wound healing, there is a lot of collagen tissue. How this collagen tissue is going to be synthesized? So basically, it is going to be synthesized with the help of platelet derived growth factor, and these are the, you can say, molecules, or these are the tissue mediators which are going to produce from the platelet and macrophages. Then after that we have the metalloproteinases, they help in tissue remodeling. We have the epithelial growth factor, these stimulate the cell growth via tyrosine kinase. So they can ask from you like how the epithelial growth factor is going to stimulate the cell growth. It is going to stimulate the cell growth with the help of tyrosine kinase, like epithelial growth factor receptor or ERB1. So these are the example of tyrosine kinases which are going to stimulate the cell growth. So please keep all these things in mind because these are the important things which they can ask from you in exam. So here I want to highlight again some important points related to chronic inflammation. First question, if they ask from you how you characterize the chronic inflammation. Chronic inflammation is always characterized by the presence of lymphocyte and plasma cell. This is very very important. Then you guys have to remember it is a delayed response. Acute inflammation is immediate. Chronic inflammation is delayed, but it is more specific. Like acute inflammation less specific, that counted in innate immunity, but chronic inflammation has more specific response that occurred in adaptive immunity. Then they can ask from you like what are the stimulatory signals for chronic inflammation, like infection most common cause, then virus infection, mycobacterial infection, parasitic and fungal infection. Then if you have autoimmune disease, if you have foreign body material, if you have cancer can also cause the chronic inflammation. So these are the important point. Then you have to remember the important thing like what kind of lymphocytes are going to involve in chronic inflammation. We have the T lymphocyte. Basically these are the immune cell which are present in the bone, which are going to produce from bone marrow, and after the bone marrow they will go to thymus. In the thymus they will get mature. So T lymphocyte are important, you can say, the participants of chronic inflammation. You guys have to remember. Then, and I already mentioned basically the CD4 cell. We divide the T helper cell or CD4 cell into two main types, T helper 1 and T helper 2. T helper 1 secretes the gamma interferon. This gamma interferon will go and activate the macrophages. Just remember one thing. Then after that T helper 2 basically secrete the interleukin 4 and interleukin 5 and interleukin 13, and they will go and help the, you can say, help to repair the infection, and they will also act as anti-inflammatory. So these are the important, you can say, points which you guys have to remember. Then after that we also have the lymphocyte plasma cell. They are also the participants of chronic inflammation. So that's why please remember, in the inflammation we have the T lymphocyte, in the chronic inflammation we have the B lymphocyte. T lymphocyte, you guys have to remember like CD4 cells like T helper 1, T helper 2. In the B lymphocyte you have to remember the plasma cell. So basically these are the immature B cell, these are the immature cells which are produced in bone marrow. Then after that they will go and become mature and produce the plasma, you can say, antibodies like IgG, IgM, IgC, IgD. So these are the different kind of immunoglobulins which are going to produce from the B lymphocyte. Then after that I already mentioned the important like tissue mediators which are going to help in wound healing, like fibroblast growth factor, tumor growth factor beta, vascular endothelial growth factor, platelet growth factor, and then metalloproteinases and epithelial growth factor, because these are the important points which they can ask from you in exam, like what are the tissue mediators that are going to help in angiogenesis. Then what are the, you can say, the important mediators that are going to help in fibrosis. So that's all about the, you can say, the acute inflammation and chronic inflammation. But in the end of this class I want to give some important tips for to you guys. Please, when you are solving the U-word question, try to read the question very well. Try to learn first from question, what the question is telling you, what the question is asking from you, because if you do not understand the U-word question very well, you are going to pick the wrong option. So that's why apply this knowledge to understand the question. Like if they ask from you, let's suppose when you solve the U-word question, you will get a person has the inflammation or person has the infection, and in the infection area you will see a lot of pus. So what kind of cells are going to be involved in this pus. So basically we see the neutrophils are going to come and produce the inflammation, and pus basically it is, you can say, after the inflammation it can happen if the infection continue. So that's why when you are reading the UWORD question, try to understand the question very well. Try to like ask from yourself what the question is telling me and what the question is asking from me. Like they can ask from you the related to anatomy, embryo, physio. So that's why it's very important to understand the question. If you do not understand the question very well, then definitely you will pick the wrong option. Then after that, I want to also share one important thing. Some students are asking from me like, sir, how many questions we should solve daily? So please, if you are beginner, try to solve the 20 question, and if you are like if you are already passed the first pass of UWORD, then try to solve 40 question each day. Try to solve the 40 question each day. Don't solve the question like more than 40 question in a day. So these are the you can say the important topics for today. Please try to revise these topics from the first aid very well, and try to learn these things by your heart. Don't try to memorize everything, because these are the conceptual things which you guys have to understand very well. Okay guys, so let's continue the next topic, that is about the phases of wound healing. So first of all, directly starting this topic, we have to understand the basic principles of wound healing first. So first of all, you guys has to remember one thing. Basically, the wound healing is only initiated when the inflammation begins. So it's mean wound healing is only initiated when the inflammation begins. So this is the first, you can say, requirement for the wound healing. If there is an inflammation in your body, if this inflammation begins, then the wound healing will start. This is the first basic principles. Then after that, this is also very important MCQs they can ask from you in exam, through which the wound healing will occur. Basically wound healing is going to occur via combination of two mechanisms. First one is the regeneration, and the second one is the repair. So these are the, you can say, the mechanisms through which the wound healing is going to occur. So these are the basic principles. Before directly starting the topic, every student must know these basic principles, like the healing is only initiated when the inflammation begins. Then healing will occur via combination of regeneration and repair. So let's discuss first about the regeneration. Then after that we will discuss the repair. Then we will combine both these things. So first of all, we will discuss here the regeneration. Then after that we will discuss here the repair. So first of all, what is regeneration? So basically regeneration, it is, you can say, the replacement of damaged tissue with the native tissue. It is called regeneration. So what is the definition? Replacement of damaged tissue with the native tissue. This is the definition of regeneration. Then they can also ask the question like, regeneration depends on which thing? Regeneration is dependent on the regenerative capacity of tissue. So it's mean regeneration is dependent on capacity of the tissue. So these are the, you can say, important points you guys have to know. Then after that, everyone should know, according to regenerative capacity, our tissues are divided into three main types. According to regenerative capacity, our tissues are basically divided into three types. So what are these three types? So first of all, we call these are the labile tissue. We call there are stable tissue. Then we call there are permanent tissue. So what is the difference like between these type of tissues? And what are the examples of these tissues? So first of all, let's discuss the labile tissue. What is labile, or what are labile tissue? What is our definition? First of all, labile tissues possesses the stem cells continuously cycle to regenerate the tissue. So this is very important point you guys have to remember. Labile tissues possesses stem cells that continuously cycle to regenerate the tissue. Like what are the examples of these labile tissues in which the stem cells are continuously proliferating to regenerating the tissue? Like you have the small and large bowel. In your intestine there are a lot of stem cells which are continuously proliferating, which are continuously regenerating the damaged tissue. Then after that we also have the skin cell. Like in your skin there are stem cells in the basal layer which are continuously proliferating, which are continuously, you can say, dividing. They have ability to regenerate the tissue. Then after that we also have the bone marrow. Like bone marrow is an example of labile tissue. In the bone marrow we have the hematopoietic stem cell. These are the tissues which have the ability to regenerate. So these are the, you can say, the examples of labile tissue. Then after that, what is the definition of stable tissue? So basically stable tissues are those that are usually in the G0 phase, but they can re-enter the cell to regenerate the tissue when necessary. So it's mean stable cell mean they are in the G0 of cell cycle phase. Basically they are inactive, you can say, and when the tissue get damaged and we have to regenerate the tissue, they can leave this G0 phase and enter the cell cycle to regenerate the tissue when it is necessary. So what are the examples? So first of all, there is example like you can say the hepatocyte, usually after the damage. Like if a person has you can say a liver problem, in the liver problem, if your hepatocytes are get damaged, then the remaining hepatocytes are your, you can say, the underlying cause will lead to other hepatocytes to undergo hyperplasia, and that will lead to the, you can say, the formation of new cells. So in the liver, it's mean when the liver is not damaged, the hepatocytes are in the G0 phase. But when the when the liver get damaged and we have to regenerate the, you can say, hepatocytes, then the hepatocytes will leave the G0 phase and enter the, you can say, cell cycle like G1 phase. So these are the G1 phase in which the cell is going to start like going to duplicate its material, going to make new cell. So this is about the labile. Then after that you guys have to understand the definition of permanent tissue. So it's mean these are the those tissues which don't have regenerative capacity. Like if a tissue get damaged, it will not recover. So what are the examples? So like your myocardial muscle, you have a skeleton muscle, then you have neurons. All these are the examples of permanent tissue. So let's take a quick review. Now first of all, you guys have to remember what is healing. Healing is initiated when the inflammation begins. Then after that, healing occur through a combination of two mechanisms, regeneration and repair. So again, what is regeneration? Replacement of damaged tissue with the native tissue, with the healthy tissue, with the new tissue. That is called regeneration. And regeneration depends on the capacity of tissue. And after that, we have divided the tissues into three main types according to regenerative capacity. Like one is labile, stable and permanent. What is labile? So these are the cells which are continuously proliferating, which are continuously you can say replicating themselves, like the in cells of the intestine, skin cell, hematopoietic stem cell. These cells are continuously dividing. They are not going to enter the G0 phase. Then after that we have stable phase. So in the stable phase, in the stable tissues, the cells are usually in the G0 phase. But when the tissue need to repair himself, or you can say when the tissue has to regenerate its own cells, then it undergo, you can say, proliferation. It will leave the G0 phase and enter the cell cycle to regenerate or to proliferate or to divide to make new cells. Then after that we have the permanent cell. Like what are the examples of permanent cell? First of all, these are those tissue which don't have ability to regenerate. So, and please remember the Examples of these tissue like skeletal muscle, cardiac muscle and neuron. So these are the important examples of the tissues which you guys have to remember. This is all about the regeneration. Then let's discuss about the repair. So what is the repair? Basically you guys have to remember, when you replace the damaged tissue with fibrous scar, when you replace the damaged tissue with fibrous scar, so with fibrous scar, when you replace the damaged tissue, it is called repair. So basically in regeneration you are not going to replace it with scar, you are going to replace it with healthy tissue, that is called regeneration. But in repair what will happen? Basically the replacement of the damaged tissue is going to you can say occur with fibrous scar. This is very important. And please remember, it only occurs when the regenerative stem cells are lost. Like if you have the deep skin cut, in your deep skin cut your stem cells are lost. When your stem cells are lost, they are not going to regenerate, it only going to replace with scar. Please keep this in mind. And this is the one mechanism by which the fibrous can form. There is also a mechanism in which the tissue lack the regenerative capacity, like your myocardial infarction. After the myocardial infarction there is a formation of scar in your heart. So in an exam they can ask from you, why a person after myocardial infarction get the scar in tissue. So basically we already discussed that in the heart there are no stem cells which can undergo proliferation. So it's mean this cell don't have regeneration capacity, so it will only undergo repair, and the repair will only occur with fibrous scar. So this is very important, you guys have to remember. Then after that you guys have to remember this one, whenever there is a repair, there is always formation of granulation tissue in the initial phase of repair. This is very important. Whenever a tissue is undergoing repair, the first point will be formation of granulation tissue. The granulation tissue, it is, you can say, firstly formed and in the initial phase of repair. So if they ask from you what is granulation tissue, basically it consists of fibroblast, like you can say the deposition of type 3 collagen, then it contains the capillaries, then it contains the myofibroblast. So if they ask from you, like granulation tissue is composed of how many components? 3 components. One is the, you can say, myofibroblast, then second one is the capillaries, and the third one is the fibroblast. So first of all, what is the function of myofibroblast? These are the cells which contract the wound. Then what are the function of capillary? Basically they provide the nutrients. Then what is the function of fibroblast? They deposit the type 3 collagen. So please keep this in mind. They can ask from you like through which, or like through granulation tissue consists of how many things, they can ask from you. So that's why you guys have to remember these 3 points. Then after that in the scar formation, we already studied that in the initial phase of repair there is a formation of fibroblast that will lead to formation of type 3 collagen. So in the scar formation, basically this type 3 collagen is going to replace with type 1 collagen. Type 3 collagen is pliable and it is present in granulation tissue, embryonic tissue, uterus and keloids. But type 1 collagen has high tensile strength and it is present in the skin, bone, tendons and most of the organs. And please remember one thing, the collagenase is an enzyme which is going to remove the type 3 collagen, and this enzyme requires zinc as a cofactor. If you want to like collagenase to work, then you have to give the zinc, because if you don't have zinc, type 3 collagen is not going to replace with type 1 collagen. So these are the important points, please keep in mind. So let's take a quick review what I teach in the repair. First of all, replacement of damaged tissue with the fibrous scar, it is called repair. Then you guys have to remember, repairment only occur when the regenerative stem cells are lost or when the tissue don't have regenerative capacity. These are the 2 indications. After that a tissue can undergo repair. Then after that you guys have to remember, in the initial phase of the you can say repairment, first one, there is a formation of granulation tissue. Granulation tissue consists of 3 things: myofibroblast, capillaries and fibroblast. Fibroblast will produce the type 3 collagen, capillaries will give the nutrition, myofibroblast will contract the wound. Then after that we have one enzyme which is called collagenase. That collagenase will come and convert the type 3 collagen into type 1 collagen, and for this we require zinc. If you don't have zinc, this process will not occur. So this is about the repairment. Then after that we have to understand the mechanism of tissue regeneration and repair. So please keep this in mind. The mechanism of tissue regeneration and repair is always mediated by paracrine signaling. Paracrine signaling through the growth factors. So this is very important point. Through which mechanism tissue regeneration and repair is going to occur? It is going to occur with, you can say, paracrine signaling pathway. And what are the growth factors? Like you have a macrophage. Macrophage is secreting the growth factor that target the fibroblast. So please keep this in mind. Growth factors are going to, you can say, mediate the mechanism of tissue regeneration and repair. You guys have to remember one thing. Then these growth factors with the bind with the different kind of receptors, like we have growth factor receptor. Then after that they can also ask from you the different examples, like we already discussed the mediators of the, you can say, regeneration and repair. Like they can ask from you what is the function of tumor growth factor alpha. So basically tumor growth factor alpha, you can say it is the epithelial and fibroblast growth factor. Then what is the example of tumor growth factor beta? It is important fibroblast growth factor which inhibit the inflammation. Then we have the platelet derived growth factor, which is required for the endothelium, smooth muscle and fibroblast. Then we have the fibroblast growth factor, which is also important for angiogenesis and also mediate the skeletal muscle development. Then we have the vascular endothelial growth factor. So this is also very important for angiogenesis. So let's take a quick review of this topic because these are the mediators. These mediators are very important. They can ask from you in exam. So let me raise this first. Then after that we will discuss one time again all these mediators that are required for the wound healing, because in the exam they can ask from you the question. They will give you the example of mediator and they will ask you the function. What is the function of this mediator that is that play important role in wound healing? So let me write all the important mediators for you guys so that you guys can remember these things for your exam. So first of all, you guys have to remember the tumor growth factor alpha. Tumor growth factor alpha, you can say it is the epithelial and fibroblast growth factor. Then after that we have tumor growth factor beta. So basically tumor growth factor beta, it is important for fibroblast growth factor. And also please remember it inhibit the inflammation. It is anti-inflammatory. That point is very important. Then after that we have the platelet, you can say platelet derived growth factor. And platelet derived growth factor is very important for endothelium. It is very important for smooth muscle and it is very important for fibroblast. Then after that we have the fibroblast growth factor. So fibroblast growth factor is also very important for angiogenesis, and this is very important MCQs. They can ask from you in exam. And also fibroblast growth factor mediate the skeletal muscle development. So please keep all these things in mind. Then after that we have vascular endothelial growth factor. So basically vascular endothelial growth factor is also very important for angiogenesis. So these are the important mediators that play a important role in wound healing. You guys have to memorize these things. So let's now take a quick read from your book, like what they mention in the phases of wound healing, like everything they mention it. So first of all, you guys have to remember one thing. The wound healing is going to occur in major 3 phases. So according to first aid, the wound healing phases are basically divided into 3 main phases. So first one is the inflammatory. You can say first one is the inflammatory, which is up to 3 days after the wound. And in this phase basically what are the effector cells that are going to be involved, like platelets, neutrophils and macrophages. So again, first of all, you guys have to remember wound healing phases are divided into 3 main types: inflammatory, proliferative and remodeling. In the inflammatory, this is the first phase or initial phase, which start after the inflammation and up to 3 days after the wound. And the cells which are going to participate in this phase are platelets, neutrophil and macrophages. Then after that they mention here what are the characteristics of this phase. So there is a formation of clot formation. So the clot formation occurred in inflammatory phase. Because it is the inflammatory phase, the vessel permeability is going to increase and the neutrophil migrate into tissue and the macrophage will come after 2 days to clear the debris. So these are the important characteristics of this inflammatory phase. Then after that we have proliferative phase, which start after the day 3 and it continues weeks after the wound. And what are the cells which are going to participate in this phase? So basically we have fibroblast, we have myofibroblast, we have endothelial cell, we have keratinocytes, we have macrophages. So these are the important cells which are going to participate in proliferative phase. And also here they mention about the granulation tissue. So basically in the proliferative phase there is a formation of granulation tissue, and in the granulation tissue we already discussed that type 3 collagen is more important, and angiogenesis is going to occur and the epithelial cells are going to proliferate. And after that the inflammatory phase, in the inflammatory phase we have clot formation, but in the proliferative phase that clot is going to dissolve and the wound will contract. And this is a very important MCQs. They will ask from you what are the cells that are going to, you can say, contract the wound. These are the myofibroblast. And as I already mentioned, the granulation tissue is basically consists of 3 main things: myofibroblast, fibroblast and capillaries. Myofibroblast are going to contract the wound, then fibroblasts are going to produce the type 3 collagen, and capillaries are going to give the nutrition. Then also because for the proliferative phase, because for the second phase of wound healing, that is proliferative phase, in your body you need vitamin C and copper. So if you have a deficiency of vitamin C and copper, your second phase of wound healing can be delayed, like proliferative phase will be delayed. So this is very, very important MCQs. You guys have to remember which vitamins are required for the second phase of wound healing. Then after that we have the remodeling. So basically remodeling, it is the last phase of wound healing, and it start 1 week or 6 up to 6 week, like in between the 1 week and 6 week, and continue for the month after the wound. So basically the important cells which are going to participate in remodeling, these are the fibroblasts. And I already mentioned type 3 collagen is going to be replaced with type 1 collagen with the help of collagenase. And you guys have to remember type 1 collagen has increased strength of tissue because it is more tensile, and the collagenase enzyme which is going to replace the type 3 collagen, it requires the zinc. So if you have if in your body there is a deficiency of zinc, the remodeling phase is not going to start. Your body, you can say, you will have the delayed wound healing. So these are the important points. Let's take a quick review from this page, like what are the important MCQs they can ask from you in exam. So first of all, you guys have to remember the important things, like what are the mediators that are going to participate in wound healing. So first of all, the important mediators are like what are the mediators that are going to contract the wound, myofibroblast. Then we have the what are the important, you can say, mediators for angiogenesis. We have like vascular endothelial growth factor. We have tumor growth factor beta, which is a mediator that is also anti-inflammatory. Here they didn't mention, but you guys can also write tumor growth factor beta, it is anti-inflammatory also. So these are the important points. Then after that, please remember the mechanism of tissue regeneration and repair, like it is mediated by the paracrine signaling, by the paracrine signaling via growth factors. And when in your body there is interaction of growth factor with the receptor, basically there is a formation of there is a result when the growth factors are going to bind with growth receptors, then it results in gene expression and it results in cellular growth, and that cellular growth is going to help in wound healing. So this is very, very important. Then after that, I mention here about the phases. So total phases 3: inflammatory, proliferative and remodeling. You guys have to remember like in which phase which vitamin is required. Like vitamin C and copper is required in proliferative phase. We have zinc, we require zinc for the remodeling phase. So these are the important points related to this wound healing.